This month, health experts seek to bring awareness to a health problem that kills thousands of Americans every year. Now, according to the CDC, every 40 seconds, someone in the U.S. has a stroke. And it's also the leading cause of long-term disability. And that's why talking about stroke warnings, signs, risk, and prevention is very important. So Bridget is standing by now to ask a doctor.
Like so many health issues, strokes are largely preventable, and it's about making good lifestyle changes. Joining us now, Dr. Sneha Jacob, a vascular neurologist with HCA Florida Osceola Hospital. Thanks for joining us, Dr. Jacob.
Thank you for having me.
When it comes to stroke, what are some of those common signs and symptoms of someone who might be experiencing stroke?
So the most easiest way to remember the signs and symptoms of a stroke is using a mnemonic that we call as B FAST. So B stands for balance. So anytime you have any type of balance issues or coordination problems, and E stands for eye, that's either loss of vision in both eye, one eye, or double vision can be concerning. And then FAST, so F stands for face, so any type of drooping of the face, numbness of one side of the face. A stands for arm, so unilateral weakness in the arm or leg. And then S stands for speech, any type of slurring of speech or difficulty getting words out. And then T stands for time. Time is brain, so time to call 911. So that's the mnemonic.
Yes. And what are some of the trends that you have noticed at your hospital?
So at our hospital, at HCA Hospital that I work at, we have noticed that, the age group for stroke in general is coming down. So it is...
So younger patients?
So more younger patients are coming in with a stroke. And actually, even in the age group 18 to 49, we're seeing a lot of strokes, both ischemic strokes and hemorrhagic strokes. And it has been sort of a rising trend over the past 10 years.
Is there any correlation or some sort of cause that we've been able to trace back to why younger patients are experiencing stroke?
So a lot of causes are the same causes and same risk factors that adult patients have, which includes uncontrolled high blood pressure or diabetes, smoking, obesity, drug use, alcohol use. And then there are some specific causes that are particular to younger populations as well, like clotting disorders, or if you have what we call as dissection, which is basically tearing of the blood vessels in the neck, and that can be due to anything like a blunt trauma, or over manipulation of the neck or overextension of the neck can cause it. And then some specific risk factors that are particular to women, that pregnancy is a main risk factor that can cause stroke. Or if you're on a birth control containing estrogen. And actually the combination of taking a birth control with estrogen and smoking kind of actually increases your risk of having a stroke.
Are men or women more largely affected?
So mainly men are mostly affected in having a stroke, especially when it comes to like older age group. However, in that young population, we are seeing more women being affected. And it could be because they're on hormones or because of all the other, particular risk factors that I just spoke about that, pertains to women than men.
Wow. And so what are some of the treatment options available when it comes to addressing those symptoms and, getting medical care right away?
So there are a lot of treatment options available, and at a comprehensive stroke center like our stroke center, we have a 24/7 neurologist who's always available to assess the patient and then decide what they need. So some of the treatments available would be what we call as a clot-busting medication called TNK or TPA, which is essentially a blood thinner, which is helpful to kind of dissolve any clot that could potentially be causing a bad stroke and kind of to minimize the effects of that stroke. The other thing that, that's been widely popular over the past 5 to 6 years would be a procedure called mechanical thrombectomy, which is essentially if there is a big clot that is visible on a CAT scan, then an interventional radiologist or a neurosurgeon can actually go and retrieve that clot to minimize the effects of the stroke.
Mm-hmm. And what are some ways to explore prevention? Because, you talked about medications and diet. What are some things we need to keep in mind, in our daily routines to lower our risk of stroke?
So, there are some things that are beyond our control, but there are some things that we can easily do. Like lifestyle modifications, I think, is number one there. So daily exercise, moderate type of exercise, maybe for 30 minutes, eating a healthy diet, quit smoking. That is number one cause of debilitating stroke. So quitting that is very important. And then I think another big thing, especially that young adults should know, is going to your PCP every year and making sure you get that annual checkup, and making sure that you don't need to be on any medications for these risk factors like high blood pressure or if you have diabetes, because there is no specific age that you could have a stroke at any age, and there's no right time to start preventing a stroke.
All right, something to keep in mind. Thank you so much, Dr. Jacob, for spending some time with us today.